We've all heard about hernias before, but what exactly are they and when do they require treatment from a doctor? Bridget is standing by now to ask a doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
So hernias are pretty common. According to the National Center for Health Statistics, as many as 5 million people suffer from hernias every year, and only a small percentage actually get treatment. So what do we really need to know about hernias? Dr. Bobby Givens, a surgeon and director of the Orlando Health Complex Hernia Center, is here with us this morning with the answers. Good morning.
Good morning. Thanks for having us.
So when we think about a hernia, this covers lots of different things. It can be in different places. Tell us more.
It does. So at its root, a hernia is a hole somewhere in the body that lets things pass through from the space that they belong to somewhere that they're not supposed to be. And as a surgeon, we worry about that because it can cause pain and symptoms, but also things can get stuck and cause more complicated problems.
So what are the types of hernias and how do they happen?
So the most common types are hernias in the groin and hernias at the belly button. One of the other more common types these days is at previous surgical incisions, as we've made a weakness. They can happen in a variety of ways. Sometimes it is congenital, so being born with it. We see babies that have hernias in the groin and at the belly button. Sometimes at the belly button they'll close on their own. In the groin they're typically fixed at a young age. And as we go through life, those same areas have weak points, and we do heavy lifting, we apply pressure, and sometimes those areas stretch and let things through again.
And so you may have something existing and it gets worse, and that's
be.
when it gets on the radar. So what are some of those warning signs that you may need to get checked for that?
So the most common things that people will come to me with are they've either noticed a bulging or a swelling in a spot, and they don't know what it is, but it used to be there. Or pain. So they'll say, hey, I now feel pain in my groin if I do heavy lifting. And I went to my primary doctor and they told me it's a hernia. Now we're here to see you.
Okay, and so how long can it go before they need to get some sort of treatment?
So it depends a little on the location and the size. Some hernias, when they're small and at safe locations, can be watched safely for years. Many people do eventually develop symptoms that require fixing. And at other sites, it's a little more concerning, or if it's very large, and we do recommend getting it fixed right away.
So are there any emergency situations that can arise from an untreated hernia?
There certainly can be. So sometimes hernias become large enough, they can let parts of the intestines through and they can become stuck. And when that happens, it can either block the flow of food through the intestines or even pinch off the blood supply to that area.
Yikes. So when it comes to the treatments, how do you figure out which option's right for the patient?
So generally what I recommend is if you think you have a hernia or you know you have a hernia because someone has diagnosed you, is go see a hernia specialist and have a conversation. Each year that goes by, it seems that the care of hernias gets a little more complicated, and who we fix and who we don't is always changing. But certainly warning signs would be if you have significant changes, significant increases in pain, all of a sudden nausea and vomiting, redness in the area, warmth, things like that.
Okay, and so this is going to entail, you said, different types of surgery depending upon the situation.
Certainly. So some locations and some sizes, it's a simple repair, just sewing that little hole closed. Sometimes, as I'm sure people have heard about, we use mesh to fix hernias, with the idea being to prevent them from coming back in the future.
And I know mesh has been in the news in previous years. What's the latest with that?
So the thing about mesh is, at the end of the day, it's a foreign body. And when it touches things or gets infected, it can cause problems. And over the years, we as surgeons have learned where we can and can't safely use mesh. And also there have been products over the years that were designed to prevent complications that didn't work the way that they were intended. So having a conversation with your surgeon about why the mesh is being used, where it's being placed, and what type of mesh is being used is important. But at the end of the day, for some hernias, it really is a necessary.
And before we go, how long could you expect to be out from something like this, a surgery to repair that?
Certainly. For small hernias, it's pretty common for people to be back to office type work within a week, albeit with some discomfort. For larger ones, it can push out to several weeks, and patients, of course, who have more strenuous jobs, we typically recommend some weightlifting restrictions in the first 4 to 6 weeks after surgery.
Okay, great. Well, Dr. Gibbons, thanks for this info, and hopefully people will get checked if they need to. I'll send it over to you, Julie. And be careful lifting, too.
Thank you.
Exactly. Bridget, thank you.